Hey, Dr. Wade here, physical therapist with Physical Therapy and Balance Centers, and I'm here to give you an update on COVID-19 as well as some considerations. Number one, we're right in the middle of the pandemic. It's July the 17th, 2020. So we have hospitalizations going up. Yes, we have case rates going up as well as death rates. And I understand there's some confusion because there are some incorrect data that are being put into the death rate, etc. And people are using this somewhat as an excuse not to take the usual protections, the recommended protections that actually do work. Let's talk about that. Number one, mask usage works. It protects you and it protects others. Okay? I know there's been debate about it, but the debate is over. Wear a mask when in public, when around other people, and also include social distancing. Okay? When going around others, wear a mask. It's that simple. Until otherwise instructed. Your physician, your local government officials, the CDC, all your healthcare organizations, we're all recommending mask usage at this time. And now, just to give you an example of some of the lackadaisical approaches here, I was in the grocery store yesterday. The week before it was even worse, but yesterday, literally, 35% of the people that were in there had a mask on. Of the 35%, only about half of them were wearing the mask correctly, including the employees of the store. Not one employee actually had the mask on correct because they have to wear it all day. I understand it's difficult. You need to have a mask that is breathable. The KN5 mask is wonderful. Surgical masks are great. Small or low profile cloth masks are good. If it's too thick, it can cause respiratory trouble, respiratory stress. It can cause extra heat. It can cause a lot of problems. It can affect your equilibrium and cause a fall. So you want to get a good mask that's recommended. There's plenty of them out there today, including your plain old, cheap, good old-fashioned surgical mask. We have plenty here at my clinic at 17045 East Main Street in Louisville. If you want to come by, we're more than happy to help you with this. These are low profile, and you want to wear them correctly. They're easy to breathe through. When you put a mask on, you want to make sure you conform it to the top of your nose at the midpoint or above. Secure the elastic around your ears or tie, whichever way you have it, and pull the bottom part below your chin to get full coverage. This is not correct, and this is what I'm seeing. People are dropping their mask below their nose. That is not the correct way to wear a mask, nor is this exposing all that, okay? It just doesn't work. So you want to make sure you are covering your nose and your mouth with it conformed over your nose. Also, wearing it just kind of like right on the tip right here, that's not correct either. Air is just coming straight out of that, okay? Correct usage of your mask is essential. Then fold it in two with the inside of the mask collapsing in like that, and set it down. If it's a cloth mask, you want to set it in the area where you're going to wash it, or if it's disposable, discard it, okay? That's correct mask usage. Very simple, easy to do. Number two, keep washing your hands. It's good to keep your hands washed. You can use sanitization when out and about, but nothing beats hand washing. Hand washing debrides the debris from your hands. It debrides the actual contaminants that could be on your hands, okay? So when you've been out in public, avoid touching your face. You can sanitize your hands for protection. However, when you get home, take 20 seconds, warm soap and water, wash your hands vigorously. There you go. Simple as that. These things still work. We know that, okay? Protects you, protects others. Let's talk about the vaccine. A lot of people are simply putting their lives on hold and they're waiting on a vaccine. That's months to even years away. I know the news media is saying that they're very close, etc. I understand that. However, when you look at the history of vaccines, all vaccines, including this one that's upcoming, hopefully we will get it. If you have a BMI of 30 or more, you may not be protected from this vaccine. You do not have a normal immune response to a vaccine. That means you're either overweight or obese. People who are overweight and obese with a BMI of 30 or more have shown not to respond to a vaccine in a protective way. I have the research below if you need to look at that, but it's not being talked about very much. It's not being considered, and it is super important. The best things you can do right now are simply protect yourself by building your immune system, staying active, getting in the sun, getting good sleep. When you're out in public, for protection, wear a mask, keep your hands sanitized, wash your hands when you get home, use social distancing 6 feet or more. These things work. I know people are tired of having to deal with this, but it's our reality at this point, and it will get better. Let's stay the course at this time. What can you do for your health if you are overweight or obese? I have a link for you below as well that can help you with that. I know people have tried to diet. I understand that. But there are other ways that help us restore normal physiology, build our immune system at the same time without compromising your metabolism. Okay? I'm about building your health. I'm not trying to compromise your health. And the tips that I've given you here will help you for sure. So I hope this has been good and valuable for you, and I look forward to seeing you in the next video. Be sure to check the links out below and ask any questions below as well, and we'll address them. Take care and be safe.